If you are not using the code now, you may be losing revenue that you deserve when performing pelvic examinations. That said, if you are not using this code properly, you may be subject to takebacks, or otherwise known as clawbacks, by CMS, Medicare, and possibly other payers. Since the publication and release of CPT code 99459 about 3 weeks ago, there has been no shortage of questions about its proper use. In this video, I'm going to discuss the current understanding of this code so you don't run afoul of any coding and payment issues later on. For those of you who do not know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we are going live right now. And also, this is all for free. The group is to crowdsource practice management solutions for everyone's benefit. Let's begin. 99459 is the code under examination today. And 99459, if you look at the CPT book, simply says pelvic examination. And today I'm going to give you as much of an evidence-based guidance as I can regarding how to properly use 99459 despite a lot of the rhetoric that is out there. Now, of course, this is based on current guidance and evidence. It is subject to change based on future clarification by CPT and CMS. 99459 is an add-on code. What that means to the layman, to the practitioner, qualified healthcare professional, it means that you cannot build this code alone. You have to build it with, you have to pair it. It's like wine and certain types of dishes. You have to pair it. And that means you cannot build it alone. The guidance says you have to list separately in addition to code for the primary procedure. For instance, you want to use 99459 in conjunction with new patient E&M codes such as 99202 to 205, or established patient visit codes 99212 to 215, and also consultation codes 99242 to 245, and also 99383 to 99387, the initial comprehensive preventative medicine visits, or 99393 through 99397, preventative medicine reevaluation and management codes. So whenever you use one of those codes, then you qualify for the use of 99459. 99459, you have to keep in mind, this is a practice expense code only, meaning you can, so I'm in private practice. When I bill for this code, my practice receives payment from the payer, CMS. And if you are an employee of, like, say, a hospital or a private equity, you're an employee, basically. When you use this code, it does not increase your work RVU because this is practice expense only. So you would be simply, as an employee, you would be reporting this for the benefit of your employer. However, in private practice, whatever the practice expense is, I will be paid net because I own the practice. So understanding that meaning of practice expense only is important for the bean counters. And also, if you're an employee, urologist, physician, you need to understand that you're not going to get any work RVU credit. Your employer is the one who's going to benefit. All right, so it benefits the facility and private practice owner, no benefit to the hospital employed physician being paid by the work RVU. Another question that is commonly asked regarding 99459 is that, do I need a chaperone to bill for this code? And I know this is a point of discussion, contention, disagreement. I'm going to bring you evidence that supports my point of view. And I am showing you CMS 1784F, page 276. And I quote, "In September 2022, the CPT editorial panel created a new CPT code for reporting a pelvic exam, CPT code 99459. The specialty societies noted that reimbursement for the work would be captured with the problem-oriented E&M code billed for the visit. The CPT editorial panel agreed. Thus, the new code is a practice expense only code that captures the direct practice expenses associated with performing a pelvic exam in the non-facility setting. CPT code 99459, pelvic exam, captures the 4 minutes of clinical staff time associated with chaperoning a pelvic examination." So I'd like to go straight to the source. Even though CPT just says pelvic exam, I am going to play it very conservatively and look at what CMS's guidance is. And I personally will not bill 99459 if there's no chaperone with me when I perform the pelvic examination. So yes, I disagree with the guru when it comes to urology coding and billing, Mark Painter. I think chaperone is needed to bill 99459, and that is what CMS stated. So that's what I'm going to go with. I'm going to play it conservatively. I don't want people who audit me come back and say, you did not have a chaperone, and then you did a pelvic exam and you billed a 99459. So first of all, who in the right mind would do a pelvic examination without a chaperone? Now, even if a patient requests, and typically as a male, when I perform a female pelvic examination, I would never, ever do that without a chaperone. Never. Even if the patient requests that a chaperone not be present, I would never do it. As a matter of fact, I don't even let my chaperone leave the room for a minute whenever the female patient is in the room while I'm performing a pelvic examination. All right? So bottom line is, don't do it. Whenever you do a pelvic examination, have a chaperone present and bill 99459. All right? And if you look at the CPT description, and I'm going to read this again. Let's see. The editorial panel agreed, thus the new code is an expense-only code for the direct practice expenses associated with performing a pelvic examination in a non-clinical facility setting. And CPT code 99459 captures the 4 minutes of clinical staff time associated with chaperoning a pelvic exam. Clinical staff time. So what the heck is who's a clinical staff? So chaperone's a clinical staff by definition. So what is a clinical staff? Clinical staff, by CPT definition, is a person who works under the supervision of a physician or other qualified healthcare professional and who is allowed by law, regulation, and facility policy to perform or assist in the performance of a specified professional service, but who does not individually report that professional service. And so what that means is someone that is designated by either the facility, the physician, the practice, but someone who does not bill for that service, meaning when the regulation says who does not individually report that professional service, in essence, it means that person who is not billing for that service. So pretty much anyone that you employed in your practice can be a chaperone. So yes, when someone asked in the Thriving Urology Practice Facebook group, when I posted 99459, someone asked, can a medical assistant helping with a cystoscopy be a chaperone when a female cystoscopy is being performed? So the answer will be yes. The MA sets things up for you to perform a cystoscopy and you perform a pelvic examination concurrently. The MA serves as the assistant for the cystoscopy and also a chaperone for your female pelvic examination. Can a scribe who is present in the room when you are doing the examination be a chaperone? Scribe is employed by your practice, so yes, that scribe can serve as a chaperone because he or she is a clinical staff member, most likely a she. And you guys are so cute. In the Thriving Urology Practice Facebook group, someone rhetorically, or maybe not rhetorically in today's day and age, asked, what about a chaperone when you perform a digital rectal examination? So this goes to the question of, or issue of gender fluidity. It's hard for me to say yes to that, because typically that person does not have, you're not doing a pelvic examination. A rectal examination is not really a pelvic examination by my standards. And I don't know, this is one of those things that's going to be subject to debate. And the other thing I'm thinking about is, what if the person identifies as a female but is a biological male? When you do the scrotal examination, is that a pelvic examination? Or if you perform a reconstructed biological male that now has a reconstructed female pelvis, is that a pelvic examination? I'm in the latter case, I'm going to say most likely yes, and I'll probably have a chaperone for that examination. But when you are doing a DRE, digital rectal examination, on a male, and you have a chaperone, that's going to be tough. That's going to be tough. Because in the CPT manual, it doesn't say female only. So that leaves it open for interpretation. That I don't know. So next question. I'm going to leave it. You let me know what you think. I'm going to leave that alone. Okay, next question. Someone asked, can it be used for cystoscopy chaperone and not pelvic examination chaperone when you perform a cystoscopy on a female, but you don't do a pelvic examination? So this is an instance where the medical, typically in my practice, the female medical assistant sets up the room for the cystoscopy. And for instance, if I happen to not do a pelvic examination, maybe a surveillance cystoscopy for an elderly female that is undergoing surveillance cystoscopy for bladder cancer, I may not do a pelvic examination. In that instance, when you are having a chaperone just for the cystoscopy, you're not doing a pelvic examination, I'm going to say no. By definition, 99459 is for pelvic examination. I think the work value, the payment for cystoscopy, most likely includes that chaperone, and I'm not going to bill for a cystoscopy chaperone when I'm doing a female cystoscopy and not doing a pelvic examination. I am sticking by the book. The pelvic examination. Cystoscopy is not a pelvic examination. So I'm not going to bill 99459 with the cystoscopy. Besides, keep in mind, when you're doing a cystoscopy and you're not doing an E&M visit, you can't bill a 99459 anyway. So there you go. That's another situation where you have a chaperone for the cystoscopy and you cannot use 99459 because, number one, you did not do a pelvic exam, and number two, you did not have an E&M, if that's the situation. Okay, somebody asked, what are the requirements for pelvic examination to use that code? And my response is, you need to have a chaperone who is a clinical staff as defined above. So the requirement when you bill 99459 is that you need to have a chaperone who's a clinical staff. I don't think it's the cost of the speculum that you use. I don't think $22.26, which is the national average, or $22.27 is the national payment, practice expense payment. I don't think that is paying for the speculum, okay? And that's why, another reason why I think a chaperone is really needed when you are using 99459, not simply when you do a pelvic examination. Even though the CPT book says 99459, pelvic examination, and that's it. All right. So another question somebody asked, do you have to use a speculum when you bill a 99459 when you perform a pelvic examination? My answer is not necessarily. What if you simply did a bimanual examination? That's a pelvic exam. It does not require the use of a speculum. So my answer is No, you do not need to use a speculum for a pelvic examination because literally you can perform a pelvic examination without a speculum. Someone also astutely asked, what about documenting cervical findings, etc., when you use 99459? Well, I think anytime you do a pelvic examination, you should write it down. You should ink it. You should write down what you find. That is just good clinical practice, good clinical care, good documentation, compliance. Whenever you do a pelvic examination, write down what you find. So whenever you do a 99459, you should document your cervical, vulvar, vaginal, urethral, perineal findings in your EHR on paper, however you document. So yes, you should definitely document the cervical findings or whatever findings that you think are necessary to write down what you found during that pelvic examination. Okay. Somebody asked, what are the documentation requirements for pelvic examination? Although there's no guidance, as I mentioned just now, you should write down not just the pelvic examination findings, but whenever you use a 99459, you should, and I do, write down the name of the chaperone who was present. Write down the name of the chaperone who was present. The clinical staff that you used for your chaperone. So whenever I use 99459, I will write in the note field of the 99459 code the name of the medical assistant who's present with me when I perform the pelvic examination. Somebody also asked, can 99459 be used with modifier 25? And the answer would be yes. All right? Unlike another code, G2211, that was released the same time as 99459, G2211, you cannot bill with modifier 25. However, the pelvic examination, 99459, may be billed with modifier 25. I see no regulation saying that you cannot bill a 99459 with modifier 25. All right. Some tips on how to use and bill for 99459. When this code was initially released, it was revealed towards the end of 2023. I started thinking, how am I going to implement this? So in my electronic health records, and I use A4, it's called Veradigm right now. Recently formerly Allscripts, and gosh, 15 years, almost 20 years ago when I started using this EHR, it was called A4. So Veradigm, in my Veradigm electronic health records, I set up something that looks like this. In what's called the clinical customization module, whenever I invoke or click on 99459, well, I have in my shortlist, and this 99459 in my shortlist does not reveal itself unless it's a female only. Female only. So that helps me remember, okay, if it's a male, it's not, obviously I'm not doing a pelvic examination, but it won't even show me the code to use on my shortlist. So this is one way to jog my memory and jog my medical assistant's memory, because often she's the one who is entering the cystoscopy code, because I typically do the pelvic examination concurrent with cystoscopy. That 99459 code will not even show up in the electronic health records. So if it's a female, it'll show up, but if it's a male, it does not show up. That helps me to not use it incorrectly and to make sure it shows up and I use it only when a female is the patient. Of course, you have to make sure your staff is entering the correct gender in the electronic health records. Typically from the practice management software, they enter the gender that is then passed on to the electronic health records. You need to make sure that they are entering that information correctly, or else that code may not show up. So details matter when it comes to billing, coding, and the care of the patient. And it starts from the very, very beginning, the staff intaking the patient's information entering the patient's information, that information has to be accurate, or else the mistakes or the missed opportunity cascades down to your documentation. Something else that I use in my electronic health records is that because the medical assistants are the ones who are usually entering the cystoscopy code in my assessment and plan, because the patients are typically scheduled for a cystoscopy, if it's female, that pelvic exam code is also shown to her. So my medical assistant will bring that into the assessment and plan. And if I happen to not do the pelvic examination, I simply delete it. This is another way to remember that this is actually being coded and billed for. And of course, if a pelvic exam is done and a chaperone was used, I will document in the notes field of my 99459 to indicate the name of the chaperone, the name of the medical assistant who was present when I perform a pelvic examination. So that's it for now. I say for now because I'm sure we're going to get further guidance from CPT, Medicare. That's without a doubt, because there's so many questions. There's so many questions regarding the use, the appropriate use of 99459. So I hope in this video, I gave you some evidence of why I'm choosing to use 99459 whenever I use a chaperone, and I'm not using it simply when I use a speculum. If you have any questions, comments, please leave them below. If you agree, disagree, I would love to hear from you and your evidence as to why you think I am mistaken. Thank you so much for the privilege of your time. Please take care of yourself and each other. Bye-bye.